Thank you, Doctor.
With a good afternoon to those who are just getting up from their afternoon nap, and good night to those who will be off to sleep again. I shall start my verbal assault on you on a very common topic, rheumatological manifestations in diabetes mellitus. In fact, India is the capital for diabetes, and rheumatological manifestations are common, but unfortunately what happens, it's not being taken well aware of. One of my students, he came, instead of telling to me about rheumatological manifestations, he came and told me, I do accept the fact that all of us have a dilemma whom to choose before marriage, and some of us may even have a dilemma after marriage. I do not have a dilemma with respect to the statement made above, but what to speak to you about rheumatological manifestations of diabetes mellitus. Now, why should I speak about rheumatological manifestations? In fact, you see my forefather is saying, why should you speak? He's asking me a question and he's telling me, why should you speak, Ramakrishna, about that? Because rheumatological manifestations are given a stepmotherly treatment, and if you were to do a Medline search, less than 1% of articles deal about rheumatological manifestations in diabetes in PubMed, which means to say that people are yet to become aware of these manifestations. Why should I speak about rheumatological manifestations? Which are peculiar to diabetes. One is limited joint mobility. The second one, which is more common in diabetes, it is adhesive capsulitis or periarthritis of the shoulder. Sometimes these rheumatological manifestations can be a pointer to diagnosis, is flexor tenosynovitis of the hands, and some of them can be a pointer to microvascular disease, especially limited joint mobility. So peculiar to diabetes, more common in diabetes, pointer towards diagnosis, and pointer towards microvascular disease. Why speak again? There is a poor awareness of these rheumatological manifestations, with the result that they are recognized quite late, and there is a delay in therapeutic intervention. This late recognition and delayed therapeutic intervention results in significant morbidity and physical disability, leading to impairment of quality of life. The second important factor is sometimes it can be a pointer for optimizing diabetes care, because poor glycemic control is associated with the occurrence of these rheumatological manifestations. What I intend to highlight in the next 40 minutes will be, what is it unique to DM? Is it more common in DM? Common in which type of diabetes? Relation to glycemic control, relation to duration of diabetes mellitus, any association with presence of target organ damage, and the management of all these conditions as far as your practice is concerned. Coming down to the shoulder, which is the most commonly encountered joint in diabetes, we call this as periarthritis shoulder or adhesive capsulitis or shoulder hand syndrome. In this particular condition, the person will have difficulty in moving his shoulders, especially abduction and external rotation. Sometimes they can have involvement of the shoulder associated with involvement of the hand, which we call the shoulder hand syndrome. And you have what is called the diabetic hand syndrome, or what is called the limited joint mobility. Then you have flexor tenosynovitis, when they'll have difficulty in flexing the fingers. Trigger finger, where you'll be with great difficulty you will flex the finger, but to extend it, it will have a triggering effect. Dupuytren's disease, carpal tunnel syndrome. Coming down to involvement of the spine, you can have a condition called diffuse idiopathic skeletal hyperostosis and osteoporosis. Diabetes can cause rheumatological manifestations in the lower extremities also, is what is called as neuroarthropathic joint or the Charcot's joint. Share with you at this point of time is that I believe in the philosophy of the Buddha. What is very important is all of us should live in the present. In fact, I have a blog called wisdomramki.com, in which I write some spiritual blogs called a book titled my spiritual voyage. The most important poem which struck me in my blog was, When I was young, I was dying every day to study well. When I grew older, I was dying every day to excel in academics. When I got into a job, I was dying every day to reach the top of the ladder. When I got married, I was dying every day to get my family settled. And now I'm really dying, I've forgotten how to live. So I think ultimately what is very important is to follow the principle of the Buddha, that we have to live in the present. And I hope this last 40 minutes you did stay with me to take home some messages as far as diabetes mellitus is concerned. Now there are certain questions which have come up to me. One person has asked me the question, is Dupuytren's contracture seen in pre-diabetic as well? No, doctor. As far as studies have shown, Dupuytren's contracture is not seen earlier in diabetes. As I told you, it is only flexor tenosynovitis and occasionally periarthritis of the shoulder. What about alternative therapy, acupuncture, acupressure for rheumatological manifestations of diabetes? The most important principle which I follow in life is not to talk about something which I do not know much. I'm extremely sorry that I should express my inability to give a perfect answer to your question, but this all alternative modalities of therapy like physiotherapy are only adjunctive therapy as far as diabetes is concerned. Well, it all depends upon the patient whether they can take it or not. I'm sorry, I do not know the perfect answer. Does diet, food intake have any role to play in rheumatological manifestations? No. But your diet and food has an important role to play with respect to the control of diabetes mellitus, not with respect to any specific rheumatological manifestations. Well, there is a myth in the medical world that certain foods can cause arthritis. Sometimes people come and say, if I take potato, my joints pain. If I take anything which is grown below the earth, it causes joint pain. There is nothing like that. There was a concept of what you called as food